Good evening. Good evening. Good evening.
Good evening too.
Okay,
Good evening
thank you.
too.
Yes. Yeah. So welcome to today's session. It will be our session 6 on building and having mother and child training. And today we'll be having our speaker, Linda Kagendo, who is from Kenya Students and Novices Association. And she's also the founder of Demystified. You will learn more about Linda and Kenya Novices and Kenya Students and Novices Students Association, and also you will also learn on our organization. I know she'll talk more about herself, and our topic today will be pregnancy week by week and how we can test for pregnancy. So welcome so much, Linda, and feel appreciated everyone for joining our session.
Yeah, good evening, everyone.
Good evening.
I'm so happy to be here. My name is Linda, and I am a nurse who is so passionate about health promotion, and that is the reason behind Med Demystified. It's a program I started just to do health education to the community, and that's the way to go for me. Kessnur is an organization under the NNEK that aims to empower young nurses and student nurses. So I'm delighted to be here today. I don't know if I'm audible enough. Am I?
Yes.
Yes.
Okay, thank you. I'm trying to get my screen so that I can share PowerPoints with you. Are you able to see my screen?
Yes.
Yes.
Okay, good. So today we are going to be discussing about ovulation, pregnancy testing, and then we are going to indulge a bit more on pregnancy week by week. And I think we just need to understand the process in which pregnancy takes. And in this case, we are going to discuss a normal pregnancy. Pregnancies can be abnormal sometimes, but we are going to look at the more of the normal side, and we are going to begin from the very first place where pregnancy occurs. So these are our learning objectives, and just as the topic suggests, we need to understand the ovulation process. You also need to understand the various pregnancy tests that are done, and then we are also going to look at the fetal development from conception until birth. And then we're also going to look at the body changes that occur in a woman from conception all the way to the birth of the child. Women also experience a number of problems during pregnancy, and we are going to look at this at every stage of pregnancy, and then we are going to understand all the problems and try to get a few solutions to those problems. And also we are going to look at the danger signs in pregnancy. And then at the end of each stage, you're going to be developing a to-do list for the woman. There are a few things that a woman is expected to do at the end of every stage or during each stage of the pregnancy for them to be healthy together with the baby. And so, sorry. And so we begin by looking at ovulation. I have quite a number of PowerPoints. I'm trying to just rush by it. If you have any question, you can drop it at the Q&A session, and we are going to answer all your questions at the end of the discussion. So what is ovulation? Ovulation is simply the process by which a mature egg, which is an ovum in the scientific term, is released from the ovary. And it's released at the middle of every cycle. Every woman has a unique cycle. some which are regular and others are irregular. And it's at the beginning of the cycle that ovulation takes place. So for example, a woman has a cycle of 28 days. We expect that the ovulation occurs at around the 14th day, and that is the middle of her cycle, all right? And then after now, the ovum has been released from the ovary. It is released into the fallopian tubes. I understand that at the beginning, you looked at the anatomy of the reproductive system, and you can flow with the position where the ovary is all the way to where the fallopian tubes are. And so this ovum stays in the fallopian tube for about 24 hours before it is dead. And so if this ovum is not fertilized before these 24 hours elapse, we cannot have a pregnancy. And instead, menstruation will take place. You also looked at the menstruation cycle, and I am sure you understand where menstruation is coming in. So we are saying that after the ovum has been released, that is ovulation, it is released into the fallopian tube. And then it stays in the fallopian tube for about 24 hours when it's alive before it dies. Now, in the fallopian tube, conception may take place or not take place. Okay? Now, fertilization only occurs when a sperm fuses with this ovum within those 24 hours. If coitus happens either before ovulation or after ovulation and meets the viable egg within the 24 hours of its viability, then we will have fertilization taking place, and that is what is known as conception. I hope we are together. We can then quickly look at pregnancy testing. Ivan, to first kindly let me know. And diagnosis of pregnancy is made on the basis of history of amenorrhea. Amenorrhea is lack of a menstruation. And it's interesting that most women realize they are pregnant after they have missed their monthly periods. And so normally after a woman has missed a monthly period, that is when they maybe start suspecting that they could be pregnant. But besides that, we have the manifestations of pregnancy classified in 3 groups. We have what are known as the presumptive manifestations. Then we have probable manifestations, and we have positive manifestations. So what are the presumptive manifestations? Presumptive means something that is subjective. It's something that the woman will tell you, I feel like, you know, that feeling of a symptom that they are reporting. Maybe they'll report to you that they have missed their period, which is known as amenorrhea. They'll report they have nausea and vomiting, which is not a confirmatory test for pregnancy, because nausea and vomiting could result from many other problems in the body. A woman could also say that they are having tender breasts, their breasts are enlarging, and this can occur as well as maybe due to hormonal imbalance. Some women also experience breast tenderness before they are having their periods, just because of the hormonal fluctuations in their body. Now, quickening is a movement a woman might feel in their belly when a baby moves. And now in this case, we are going to refer to it as a fetus. It's only a baby after it is born, all right? So we are going to talk about a fetus. So quickening is that the feeling of fetal movements inside the belly. And it is not a confirmatory test for pregnancy as well, because sometimes people have pseudo pregnancies. You may come across a woman who has tried to conceive for a number of times, and it gets to a period when they really feel pregnant and they are not literally pregnant. So they might feel these movements in their abdomen, which are not real movements, but psychological movements, okay? But then quickening actually happens in a real pregnancy as well. So these are just presumptive manifestations. And as I have said, they are symptoms that a woman might report when they think they are pregnant. Next, we have the probable manifestations. Now, we normally have signs and symptoms are what we have called the presumptive. Probable manifestations are those things that you, for example, as the health provider, is able to identify. You can see them, and probably they could point you towards pregnancy, but we still need to confirm a pregnancy. So with probable manifestations, they are quite a number, but I just picked just 3 that we can relate to. So you could see an abdomen that has enlarged, and this also does not always mean that a woman is pregnant. Okay? The abdomen can be enlarged due to many other medical issues. For example, they are having what we call an unviable pregnancy. And sometimes there's a pregnancy where we have the sac forming, but then there's no fetus in it, and the abdomen will enlarge as a normal pregnancy. So abdominal enlargement is not a show of pregnancy. We also have skin hyperpigmentation, and this is a darkening of the skin that is normally known as the face of pregnancy. Most women, when they are pregnant, will have a lot of changes in their skin, and it's normal, but all the same, it can also happen due to other reasons that are not pregnancy. So when you see a woman who has her skin color changing, does not always mean they are pregnant. Now, next we have an increased level of HCG in maternal blood and urine. HCG is a hormone that is produced by the cells of the embryo. You'll get to understand what the embryo is as we move on, and it's the basis of a pregnancy test. But there can be HCG in the blood of the mother when they have a molar pregnancy. A molar pregnancy is what I have just explained. Conception takes place. What we call maybe the sac where the fetus is supposed to be is there, but inside that sac, there is no live fetus. So it is just a sac and there is HCG produced. So sometimes women are tested for pregnancy. The test is positive, but they do not have a viable pregnancy. I hope you're getting me to that point. So we've talked about the presumptive and the probable manifestations. And at this point, we now need to confirm pregnancy, like for real confirm there is pregnancy. Besides seeing all these signs and symptoms, we need now to be able to be sure that this woman is pregnant. And that is now what we are calling the positive manifestations. These positive manifestations include a pregnancy test, and we have already ruled out that the HCG, which is the human chorionic gonadotropin hormone, can be present in the maternal blood or urine to show a positive pregnancy test, but it is not an ultimate pregnancy confirmation test. I hope we are together up to that point. And just to give you a little bit more details of HCG, let it not be a big term that you cannot understand. It is basically a hormone that is produced by some cells covering the embryo, and it is found in the woman's blood or urine by the 5th day post-fertilization. And so this is why maybe a pregnancy test can be done in the first week of conception, and it could turn positive. And now this is when now people will go get the pregnancy strips. I wish I had one to show you, but I'm sure most of you are familiar with it. And they are able to test the urine on themselves to get the pregnancy results. It can also be tested in blood. And now we get to look at the more definitive pregnancy tests. One is an ultrasound. An ultrasound is one confirmative way of confirming a pregnancy. Through an ultrasound, you're able to visualize the fetus. And so this one cannot lie to you. whether a woman is pregnant or not, because if there's a fetus, you will definitely be able to see it. Unlike now, the pregnancy test that could have a positive HCG, and then it turns out to be a molar pregnancy. And there are also some other reproductive system tumors that could lead to a woman producing HCG. So we cannot fully rely on the HCG test to confirm a pregnancy. So we have the ultrasound, and then we also have the palpation of the fetus. Palpation is basically touching around the woman's belly, and you can feel the fetal parts. So if that is the fetal parts can be felt, it basically means we have a fetus. Okay, and then the last test is a fetal heart that can be identified. This can be identified by your reproductive healthcare provider, and it can be identified either through the ultrasound. The fetal heart can be seen, or through a fetoscope. Now, if you have attended an ANC clinic, there's that a hollow stuff that nurses will use to listen to your belly and to try to listen into the baby. That is what a fetoscope is. And now, if there's a real pregnancy, the fetal heart can be heard through that fetoscope. I hope we are together up to that point. And as I said, you can keep your questions coming. All right, was checking out at the chat box, and we are okay. So next we move to the main agenda of the day, and that is pregnancy week by week. Pregnancy entails a lot of things. I may not be able to discuss all of them due to the limited time that we have, but I'll try to touch on the major things that we need to know as the people that will be providing maternal health care to these women and their families. And we are going to look at this, having structured the pregnancy. The pregnancy is a 9 months period, and it's structured in 3 trimesters. And each of the trimester contains 3 months. The first trimester is from the first week to the 12th week of pregnancy. And we have the second trimester starting from week 13 all the way to week 27. And then the third trimester starts from week 28 all the way to the 40th week, or just from week 28 up to the time a woman may deliver. A term pregnancy is up to about 37 weeks, but may go up to past 40 weeks. Somebody saying something? All right. So I think you can appreciate the image that we have here. That is from the first week when we just have 2 cells. You can see my pointer, and this is the point of fertilization, where the ovum and the sperm is meeting. Then we have division of these cells. You can see at this point, we have the cells dividing, and then you can see the fetus forming, and you can just see the progress until we are at term. And I think it's an exciting journey. So as we begin this discussion, I would like you to visualize where we are at stage 1, so that at every stage you're able to just visualize the image of that fetus in your mind, get to figure out what could be happening. I wish I had videos, but I'm sorry for today we don't have. So I think you can just have that picture in your mind as we go along, so that you understand what is going on. And now for each of these stages, as I said earlier, we are going to be looking at the fetal development. What is happening with this fetus? It has just started as an ovum and a sperm, but then as the pregnancy continues, there are changes that are taking place in this fetus until we have a term, we have a baby at the end of the pregnancy. And then the woman is also experiencing a lot of changes in their body. Pregnancy is not something normal in their body. And so as the pregnancy continues, they change. I mean, a lot of things occur in their bodies, and that is why we are learning about this, so that we are able to understand what women go through. And then we are also able to understand the problems that they experience at each of these stages and the possible solutions that we can offer them. We also have some signs that show that the pregnancy is not going on so well, that they need to be checked. And that is what we are calling the danger signs. And then we are also going to look at what things the woman needs to do at every stage of the pregnancy, so that by the end of the pregnancy, we have a woman who is ready to become a mother, and they are also ready to, to just take up the new responsibility that has come their way. So in the first trimester, that is from the 1st to the 12th weeks, begins at where we have conception. And we said conception is where we have the sperm and the ovum coming together to form the zygote. Okay, so at this point we are having the zygote, and it is being formed at the fallopian tube. We came from the ovary, we are now traveling through the fallopian tube so that we get to the uterus. So the fertilization has taken place at the fallopian tube, and the zygote has been formed. So this zygote starts traveling to the uterus along the tube. And as it is traveling, it undergoes division. Remember, there were 2 cells at the beginning, and division means that these cells are dividing. Okay? And by the 4th day after conception, this zygote enters the uterus. And now when the zygote gets into the uterus, we have the embryo. In the 2nd week of pregnancy, that is when implantation is taking place. Implantation is just the embryo attaching itself to the walls of the uterus. And in this 2nd week, we have HCG being produced by the outer cells of the embryo. Now we have said there was division of cells, and now we have the inner cells and the cells that are covering the embryo. So the cells that are on the outside part are the ones that are producing this hormone HCG. And this hormone is the one that is responsible for maintaining the pregnancy, and it will prevent menstruation. From the menstrual cycle, you got to understand that menstruation happens when there is no fertilization that took place, and the uterus always every month is prepared to receive a fetus. So when there is no fetus implanting at the uterus, then the uterus is shed off, and that is what is called menstruation. But in this case, we have fertilization that took place, and we have the embryo that is implanting to the uterine wall that was prepared already. Now, from around week 3 to week 4, the embryo is curved. If you can remember from the image I have shown you, it's a semicircular thing. And it's at this point where some body systems begin to form. From just being cells to body systems beginning to form at this point. And it is a very crucial point in pregnancy where every woman needs to be very, very careful, because now the habits of the woman might interfere with the formation of this, of the embryo, with the development of the fetus. And between the week 3 to week 4, we have a heart that starts forming, and it begins to beat. And by around the 16th day of the pregnancy, we have the neural tube that is formed. The neural tube is what later develops into the brain and the spine. So it begins forming this early, as well as a layer of skin starting to develop. If the fetus can be visualized through an ultrasound, you can see the limbs budding, and they appear like some small, do I call them pimples? Something like that, because they are very, very tiny. But I hope you can appreciate the progress that the embryo is making in development. cell division continues in this very early stage of the pregnancy. And I guess at around this time, most women are not aware that they are pregnant, and especially if it was not a planned pregnancy. If a person was planning to get pregnant, maybe after coitus, they would want to get tested and follow up on whether they have conceived or not. But in the case of an unplanned pregnancy, a person at this point certainly does not know that they are expectant. Yeah, and so more body systems are formed and they are continuing to develop. We have said the heart also starts forming and it begins to beat. And on ultrasound at this gestation of the pregnancy, the heart can be heard. Okay. And at the 9 to 12 weeks of pregnancy, the heart is completely formed. The fetus can make small movements that can be seen on an ultrasound. If you have attended an ultrasound of a very early pregnancy, you can just see very little mild movements on the ultrasound, but the woman is not able to identify these movements until later in pregnancy, because at this stage, as I have said, they are very small movements that the woman might not necessarily be able to feel. And now we have also the bones of the face that are forming, the eyelids of the embryo are closed, the placenta is developing. Now the placenta is that organ that is able to nourish the embryo while in the womb. You remember at this point, the embryo is not able to maybe produce food for itself, that has not developed lungs to be able to take in oxygen. And so it needs an intermediate between itself and the mother to be able to grow. So it is the placenta that takes the role of nourishing the embryo. And the fetus continues growing and maturing at each stage of the pregnancy. Now, the woman experiences changes as well. And one of the most common things they will realize is a missed menstruation. And it's in this first trimester, maybe after every woman knows when they expect their periods, if they have regular periods, and it's during this trimester when they realize, oh, I missed a period. And maybe they would want to go and check for pregnancy or something. And so it's one of the basic changes that will occur, because now with a pregnancy, there is no menstruation. There is also breast tenderness, and this occurs due to the hormones of pregnancy. There is now the hormone progesterone is what is produced to be able to maintain the pregnancy. And so these hormones of pregnancy is the one that causes the breast to be tender. Now, the breast tenderness also is related to the breast trying to enlarge and prepare for breastfeeding. You see now the brain already knows that there's a baby coming, and so it needs to start preparing the body to be able to produce milk for the baby after birth. So that's why we also have breast enlarging, and then there is also thick white vaginal discharge. The thick white vaginal discharge is produced so that it closes up the cervix so that the pregnancy can be held up. So if as long as it's a thick and a white discharge, it is very normal. It is only abnormal if the discharge is either foul smelling or it is not white. But as long as it is thick, it is white and it does not smell, the woman is not itching themselves, then it is a healthy discharge. Well, at this stage, the woman might experience quite a number of problems, and some of them include pervaginal spotting or bleeding. There's a difference between spotting and bleeding. Spotting is when the woman notices just a few spots of blood in her panties, and there's bleeding when it's just literally bleeding. So spotting is normal during the first weeks of pregnancy, because during implantation, we have the embryo trying to get into the wall of the uterus. And as it tries to dig in, there could be very mild bleeding that will result to spotting. That is very normal, and it doesn't spot for long, for just a day or two. But then when it comes bleeding, then that becomes a danger sign. We do not expect any bleeding in pregnancy. So any woman who experiences bleeding at any stage of pregnancy should seek care. The other problem they might experience is breast tenderness, and we have said that it's due to the hormones of pregnancy. They can solve this by maybe getting a larger bra so that they feel comfortable. We also have constipation. I have mentioned the hormone progesterone. So it decreases the ability of the muscles of the stomach to be able to propel out food from the stomach. And so this will, in the long run, cause constipation. And this can be managed by them eating more fiber. Things that have whole grain, they can also get fiber from fruits. And they should also take extra fluids, extra water. They can take juices, they can take soups. That will help to soften up the food in their system, and it will prevent constipation. They can also take some physical exercises, but exercises that they can tolerate. We will not tell a pregnant woman to go to the gym and do strenuous exercises, but there are those very simple exercises that maybe walking a little bit and swimming. Some can even swim, just exercises to keep them fit. Oh, sorry. We have the issue with the discharge. If it's too much discharge, they can consider putting on a panty liner, and this panty liner should be changed oftenly to prevent now them having an infection. And they only need to stay home if the discharge is not smelly, they are not itching themselves, and the discharge is white. Now, when they begin having a discharge that is smelling, they are itching their private parts, they need to consult a doctor. At no point should a pregnant woman go to a chemist and get drugs for themselves, okay? And this is because we have said a lot of changes is taking place. We have the fetus developing, and now whatever this woman takes in is likely to affect it is likely to affect the growth of the fetus. So at any point, any pregnant woman needs to get medication from their doctor. They cannot self-medicate. We also have fatigue, so they need to get rest and get IFAS. I will talk about IFAS in the next slide of what they need to do at this stage. They also may experience food cravings. That is normal, food cravings, okay? But now when they begin craving non-food items, which we call pica, it becomes very dangerous for the mother and the baby. You have seen ladies who want to chew stones. I have seen one who wants to take in staplers. It becomes very dangerous, and they need to see a doctor because it certainly means they are lacking something, okay? So eating such things is not healthy for any pregnant lady. They may also have issues with heartburn. And heartburn comes in because the progesterone is relaxing almost all the muscles of the body. There is a small sphincter that closes the esophagus, that is the food pipe, and it is located at the junction of the food pipe and the stomach. And when food goes into the stomach, this sphincter closes and food is not able to go back to the food pipe. But in pregnancy, the progesterone hormone, the progesterone hormone is relaxing this sphincter, and it allows it just leaves an opening, and so food is able to come out from the stomach and back into the food pipe. Remember, we have acid in the stomach, and so when this food is in the stomach, it mixes with the acid. And now when it goes back to the food pipe, because the sphincter is relaxed, the woman experiences heartburn. And the woman can manage this by taking small frequent meals so that the stomach is not full and food has to come out again. So they can just plan their meals in a way they don't take big, bulky meals at a go, just taking small but frequent meals. And then advise them not to lie down immediately after eating, because the moment they lie down, they are allowing themselves to have the food going back into the food pipe. So they should eat at least 2 hours before they sleep. And after eating, they stay upright for like those 2 hours and allow digestion to take place. They also need to avoid taking foods that are greasy, that is a lot of fatty foods. They also need to avoid acidic foods, and they elevate the head of the bed when sleeping. This can be done by the use of pillows, just to ensure that the head is above the stomach level. Now, they also have mood swings, and it's normal. So we just need to support them. Okay? And when a woman is not psychologically supported during pregnancy, they might end up suffering what we call postpartum psychosis. Okay? So we need to be able to support them psychologically, understand what they are going through, and try to encourage them. We don't need to bash them out due to mood swings. We just need to be there to support them. Okay? And then we also have nausea, which is very common. That is commonly referred to as morning sickness. So they can just sip some water, have some crunchy snacks like crisps, they can take in biscuits, and they also need to avoid smelly and fatty foods. And if the nausea is beyond their control, they need to see their doctor. We also have some women who experience vomiting, and they should see a doctor so that they can be managed properly. Now, these problems, it's not necessarily that every woman will experience these problems. They are just the common pregnancies. We have women who have very smooth pregnancies, and thank God for that. But now we have these other minor issues or major that could occur. And if they have any problem that they cannot be able to handle at home, then they should be able to see their health provider. Let me sip some water. All right, so what do we and the women do at the first stage of pregnancy? They need to start their antenatal clinics. A woman needs to start clinic immediately they realize they are pregnant, and it's actually advised a woman that should see a health provider when they think of conceiving. It is very important to have someone that is following up on you throughout the pregnancy and have the various things that need to be done for you by the health provider. It is also very necessary because you have a lot of education that happens at the A&C clinics, and then you also have some tests that need to be done. You also need to be, some of those tests include you knowing your HIV status for the safety of you and the baby, you knowing your blood group, amidst other tests. Now, when you start the clinic, you will be started on IFAS. I mentioned this earlier, and this is simply some iron tablets, iron and folic tablets. They are very, very important for the development of the fetus. We have babies who are born with conditions that, sometimes they have missing body organs, and this could be because of lack of IFAS. It is very, very essential, and that is why I'm insisting on women starting their antenatal clinics as early as possible. In the first trimester, we have seen a lot of fetal development taking place, and the IFAS is supposed to aid in the development of quality organs for the fetus. The woman needs to start planning themselves, including financially. They need to get a cover. Here in Kenya, we have what the government has started, the Linda Mama program. And so every woman who does not have an insurance cover, you don't have an NHIF or the other commercial covers, Linda Mama is available for our Kenyan women. So it's at this point the woman needs to start planning themselves. We have seen women who are coming in with labor, and that is the point where they start wondering what to do, but they have been pregnant for 9 months. So we need to get them planning themselves as early as possible. It will also reduce a lot of pressure that comes in when a person is about to deliver and there's a lot they have not done. The lady also needs to break bad habits. If they are drug abusers, like they use alcohol, cigarette, or whatever kind of substance abuse, they need to stop it for the sake of this baby. Now, actually all these drugs contain substances that are harmful to the fetus. So they alter the way the fetus is growing, and the fetus may end up having malformations just because of the substances that the woman is taking in during the pregnancy. They also need to enrich their nutrition so that they are healthy, so that they are able to have a healthy pregnancy and also have a healthy baby. This baby is also depending on the nutrients from the mother. So the mother needs to be taking in nutrients that will benefit both herself and the baby. And as I have said, they need to start planning for the baby. As soon as they are pregnant, they need to start putting in order things for that baby. And as again I said, they should not medicate themselves. At no point should the woman go to a chemist and buy drugs. Drugs need to be prescribed for them, and they should be drugs that are safe for pregnancy. Not all the drugs that can be taken by a pregnant woman, and that is why they need to see a health provider to get prescriptions. Oh, okay, I hope you guys are learning.
Yes.
Are you learning?
Yes.
A lot.
Ah, good. Now we have these signs that if a woman notices, they need to be seen immediately. There's severe abdominal pain, and this can happen at the very early stage of pregnancy and is one sign of ectopic pregnancy. An ectopic pregnancy is a pregnancy that occurs in the fallopian tubes. We said fertilization occurs in the fallopian tube, but then the embryo is implanted in the uterus. But in the case of an ectopic pregnancy, the embryo is implanted in the fallopian tube. And the fallopian tube is very, very tiny, that cannot allow the growth of this embryo to a term fetus. So that is what we are calling the ectopic pregnancy, and it may present as very severe abdominal pain amidst other causes of severe abdominal pain in pregnancy. We also have bleeding. We have said a woman having bleeding in pregnancy is completely abnormal and they should get checked up, can be a sign of a miscarriage. And that's why they need to consult. We have severe dizziness. It's also a danger sign in pregnancy, and they need to be checked. So I'm trying to rush up with time. We can now move to the second trimester, and I hope you can visualize where we are with the embryo and with the mother. Okay? At this point, you should be visualizing a woman who has started having a bump and a baby that is developing very nicely. And then we get into the second trimester, and we say the second trimester is from the 13th week to the 16th week. At this trimester, we have the ovaries and the testes are fully developed, and the genitals, that is either the female or the male genitals, are forming outside the body. Excuse me. And at this point, through an ultrasound, the sex of the fetus can be determined. Now, it's at this stage where the fetus is also swallowing the amniotic fluid. We have the fluid that covers the baby all round. The baby inside the uterus is usually in a sac, and inside that sac is the fluid that is known as the amniotic fluid, and the baby floats in that fluid. So the baby at this point swallows the amniotic fluid and passes it out through urine. Now, the baby at this point is also covered by very fine hair on the body that is known as lanugo. If you have had the chance of seeing a baby that is born prematurely, they normally have a lot of hair on their skin. That is what is called lanugo. And then the fetal heart can be heard at this point using a fetoscope. And that is now when you attend your clinics, your midwife listens to the fetus and they can hear the fetus. And just to say this, men also need to be involved in the antenatal clinics. Men in the house, please, when you have a pregnant lady with you, kindly support them. They need a lot of support. You also need to be able to bond with the baby. I have said this because when you accompany your partner to an A&C clinic, and as the midwife listens to the fetal heart of the fetus, you can also be able to hear that fetal heart. Gentlemen, are we together?
We're together.
Good. Yeah. Now it's at this point now when the woman can feel the baby kicking. Okay, that is what we called quickening at around the 17th to 20th week. And then the skin is developing and transparent. It's not as thick as the adult skin. And now back to the first point of quickening, every woman needs to note the point at which their baby started kicking. This will be very crucial in determining how safe the baby is or if the baby is okay. Because one of the danger signs we will mention is a decreased fetal movements. So a pregnant woman needs to identify the regularity of the fetus kicking. They need to know how often they kick, how many times in a day, so that in case there is reduced fetal movements, they can identify and be able to alarm. Now we also have the airway of the fetus developing, that is the bronchioles, and at this point, the fetus can hear sounds. I think you have seen in movies people trying to speak to their unborn babies, and it is okay to do that because they can hear. So at this point, parents need to start bonding with the unborn fetus. And now the placenta is well developed and it continues to develop throughout pregnancy and it continues feeding the fetus. The organs continue maturing and the fetus can now make very strong kicks, and sometimes you can be able to see them on the abdomen of the woman. The fingers and the toes are fully formed, the eyelids are opening, and the fetus starts blinking. Now let's look at the mother. We have the abdomen that's enlarging. So as the fetus is growing, the abdomen of the woman also enlarges to be able to accommodate the growing fetus. The woman also gains weight. Remember, we have the products of conception, we have the fetus itself, it has its own weight. And so that adds up to the weight of the woman going up a bit. And then we have also said that she can feel the baby move from about the 16th week. This is very normal. And now sometimes you have had women complaining of their babies kicking too much that they can't sleep. So when they are able to identify the times when the baby kicks, they can be able to plan their sleep well. Now on palpation, the fetus can be felt above the umbilical cord. And then there's this dark line that forms from the umbilicus all the way to the pubic area. It's darkening. Remember, we talked of hyperpigmentation in pregnancy. And then we also have stretch marks that appear on the belly and the breasts. We have said that the abdomen starts enlarging, and we also have breast enlarging. So as the body muscles enlarge, it is normal for them to have stretch marks. And then the breasts, for some women, might start to leak a little milk. Remember, we said that the body is preparing itself for breastfeeding. The problems these women might face at this point include frequent urination. This is because the fetus is pressing on the bladder. So a little urine in the bladder causes the woman to want to void the bladder. So it is normal, and they can handle this by avoiding taking too much fluids towards evening so that their sleep is not interrupted. Let them take fluids during the day, but when it nears evening, they cease taking the fluids so that they don't keep waking up at night, and which will in turn cause fatigue if they're not able to have enough rest. They may also experience back pain, and this is because of the hormone progesterone that we said relaxes the body's muscles. So when a part of the backbone is relaxed, they might experience back pain. And now we also have the pressure being applied by the fetus. Massages can be done for them, and then they can also apply something warm to the back to relieve the pain. They can also watch their sitting positions and their sleeping positions as well. We talked about heartburn, and then they could experience a drying skin due to the stretch marks. They can manage this by moisturizing using the various oils that they use. Lack of sleep is common because of maybe the baby's movements, because of the pressure that is being applied on them by the baby, but they can manage this by using pillows to elevate the baby's bum. And it's advisable that a pregnant woman sleeps on the left side to avoid pressing on blood vessels. Okay, so the fetus might end up pressing on very important blood vessels that return blood back to the heart, and that will now lead to the woman having a lot of edema. And so to avoid this, they sleep on the left side and also elevate their legs. That's another problem that we have, the edema of the legs. And this can be managed by elevating their legs. So every time a pregnant woman is seated, they perhaps need a stool for them to have their legs on it. And by doing so, the blood from the legs is able to go back to the heart, and that will prevent or in some way relieve the edema that they might be having. Although now excessive edema is still a danger sign and they need to be checked. Now we move on to the things that she needs to do. She needs to continue her A&C visits. In the past, WHO used to have 4 antenatal visits, but currently it's at least 8 visits, okay? That means that the woman needs to attend A&C once every month of the pregnancy. I hope we are together. At this point, they also need to start their tetanus vaccines. Tetanus vaccine is very important for both the baby and the mother. And tetanus vaccine is given at 16 weeks of pregnancy. In the first trimester, we said we are avoiding any drug that is not necessary so that we are not affecting the development of the fetus. So tetanus vaccine will be given when you attend your A&C clinic from the 16th week. It will depend with the number of pregnancy you're in. And now that will determine the number of tetanus vaccines you will be given. If it's in the first pregnancy, you're given your first tetanus at 16 weeks, and then you're given the second tetanus dose 28 days after tetanus 1. Okay? Now, the other tetanus doses are given in subsequent pregnancies. In your third pregnancy, you're given 1 TT vaccine, and that will be given from the 16th week. If it's a 4th pregnancy, it's just 1. So it's only in the first pregnancy where you're given 2 tetanus vaccines. It can also be repeated if the duration between the first tetanus vaccine, the duration between one pregnancy and another is more than 10 years. So if we have that window of more than 10 years, then in that pregnancy after the 10th year, you might be given 2 doses of tetanus vaccine. I hope that is well understood. They need to continue supplementation with IFAS, and they also need to prepare a birth plan. A birth plan is involved where will they give birth, how will they get to hospital, the clothes for the baby, financial planning, everything that a baby needs to be taken care of. They also need to start buying clothes and all that. They can also do pelvic floor exercises. These are the Kegel exercises, I might not be able to indulge in that. We have just about 6 minutes. So at this point, the danger signs include swelling of the face, hands and feet. We have severe headache. There's blurring of vision when they are not able to see clearly, things become blurred in their sight. And there's also bleeding. These first 3 danger signs, that is swelling, severe headache, and the blurring of vision, are signs, of what is called preeclampsia. Preeclampsia is high blood pressures in pregnancy, and it is very, very dangerous. So if a woman notices any of these signs, they need to go get checked. Oh, we move to the 3rd trimester. And it's beginning at 28 to 32 weeks. And the fetus is weighing about 1 kg at that point, a kilo of meat. So the baby has sucking reflex. We said they were already swallowing the amniotic fluid, and the sucking reflex at this point is present. The sucking reflex is very important so that the baby is able to breastfeed once they are born. So if through the ultrasound, you could see the baby sucking their thumbs or fingers, and that means they are ready for sucking. The skin becomes more smoother and the hair begins to disappear. And the fetus at this point is gaining so much weight. And that is now why at this stage of pregnancy, the woman also gains weight more rapidly than in the first stages of pregnancy. And the baby bump is also growing more rapidly than in the earlier stages of pregnancy. Most of the organs in this trimester are fully mature, except for the lungs and the skin. And now towards the end of the pregnancy, that is about 37 to 40 weeks, normally the head of the fetus has turned upside down and the head is in the pelvis ready for birth. We have abnormalities in pregnancy where maybe the fetus has not turned. We have the breech pregnancy, and we have the breech position where the fetus has not turned to be able to be born normally per vagina. And now we also have the bones and the muscles that have already been formed. The skin is fully formed. It's now a fully grown fetus, and it's just about to be born. Now, the mother can feel the fetus on palpation. The fetal parts can all be felt. And that is now when you go for your clinics, the midwife is able to tell you how the fetus is lying, because they can be able to feel the head, they can be able to feel the feet and the legs, the feet of the fetus. The cervix at this point starts thinning, and now the woman's body starts preparing itself for labor. Remember, we said the cervix at the beginning of the pregnancy is thick. There's a mucus that is already plugging in there to be able to hold in the pregnancy. But towards the end, now the cervix will start becoming thin to be able to allow the baby to go out, okay? Now, there was a problem with breathing. I think I didn't mention that, but because of the growing fetus in the abdomen, the fetus compresses the lungs. And so the woman might have problems with their breathing because their lungs have been compressed. They are not able to breathe well. So they need to be able to sit upright for them to breathe more comfortably. But towards the end of the pregnancy, now the fetus goes down into their pelvis, okay? That it is known as lightening. They feel lighter because now the fetus has gone into the pelvic bones of the woman ready to be born. And now it leaves much more space up here for breathing, and they feel more comfortable. The problems, there could be heartburn, there's the breathlessness that we have talked about, frequency passing urine, and backache due to the relaxation of the back muscles. And the danger signs here are high blood pressure. Now, blood pressure needs to be monitored throughout pregnancy, and that is also an essence of attending the ANC clinics, because at every clinic, your blood pressure is measured. There's drainage of liquor. Liquor is the amniotic fluid. So if there's drainage of liquor before the the pregnancy is term, that is a danger sign, because it might result to infections to the fetus and also preterm labor. There's also reduced or absent fetal movements. I said that a woman needs to understand the way their fetus moves, so that if there is reduced movement, they are able to detect that early enough. We also have severe headaches. There's convulsions. Convulsions are not normal at all in pregnancy, and they are also, they now are what we call eclampsia. We talked about preeclampsia earlier, and now when preeclampsia has not been managed, it gets to convulsions, and that is now what is known as eclampsia. And this is very, very fatal. There is also difficulty in breathing, and towards in this stage of pregnancy, if it's not manageable, there's that normal difficulty in breathing because of the compression by the fetus, but now a woman might experience very high levels of difficulty in breathing, and they need to be checked, because maybe it could be what we call an emboli in the lungs, and it can be very dangerous for her and the fetus. Now, at this point, the woman needs to prepare a birth pack. A birth pack will contain clothes for the baby, a change of clothes for the woman. It needs to contain cotton. I wish we had time to look at the contents of a birth pack, but that's an assignment for each of you. Kindly look at what a birth pack should continue, so that at this time, a woman needs to always have their birth pack with them wherever they go. Sorry, labor sometimes may not give you a warning, so you need to be prepared always. We said that they need to prepare financially, and at this point now, from the very first stage of labor, they need to understand what the signs of labor are. The signs of labor are contractions that are regular and they increase in intensity. It starts as very small contractions, but with time, the contractions become more and stronger. There's also what we call show, and that is bloody mucus that comes from the vagina. Mucus that is bloody, okay? And that means now the mucus plug that was closing the cervix is now out to be able to allow the fetus, the baby, to come out. There's the breaking of waters. That is another sign of labor, and there's an urge to go to the toilet. We have said that at the point of labor, the fetus goes down the pelvis, and as it's going down the pelvis, it's pressing on the rectum, and now that's why they have an urge to go to the toilet for a long call. Now, there is also false labor, and a woman needs to be able to differentiate between true and false labor. Now, for true labor, contractions start as small, but with time they intensify, okay? But with false labor, the contractions vary. They are many, they are little, like you can't give a sequence for those contractions. Now, with true labor, even if a woman walks, a woman does exercise, a woman changes their position, the contractions do not minimize, or they do not go away. But with false labor, the contractions may decrease, either with exercise, with changing of position, and all that, okay? Contractions in true labor, as I have said, with time they increase, okay? But for false labor, they do not increase. You may notice that either they are decreasing or they are at the same interval. I hope that is clear. And so the woman will need to be able to identify that, but in case of any of the signs of labor, they need to be attended to. They need to get themselves to a facility where they can be assisted to deliver their babies. So I hope that you have been able to visualize through the whole process. I know I have been very fast, I'm sorry for that, but I was just trying to cover up the whole session with the limited time that we have. but I hope you have been able to capture the important details, and especially what the woman needs to do. And we have been able to gain knowledge on the few things that we can be able to do to assist a woman during their pregnancy. So with that said, I would like to come to the end of the session unless there are questions that I need to answer. Those are my contacts. You can always reach out to me through any of the above contacts, and I'll be glad to be of help to you. So back to you, our moderator. You can take us to the questions and I'll be glad to answer. Thank you.
Thank you, Linda, for that awesome session. I really learned a lot today, and I hope everyone else also learned a lot like me. So I've compiled the questions in the chat box. We have several questions from the participants. So the first question is from Irene Okello. I have a friend who always has a miscarriage when she's around 1 month pregnant. There's a time she was told she had a forced pregnancy. What causes all that? She's diabetic and could that be a reason?
Now, having mentioned that she's diabetic, we need to get to know if the diabetes is well controlled, because if diabetes is not well controlled, it might lead to miscarriages. So she needs to follow up with her doctor and get to the bottom of diabetes, as well as do tests. I think after every miscarriage, she needs to follow up on the cause of the miscarriage.
Thank you. I hope Irene, you answered. So we'll go to the second question from Wendy Ochen. Can you test for pregnancy test 1 week after having unprotected sex?
Yes, you can. We said that HCG is present in the maternal urine and in the blood by about the 6th day of pregnancy, so you can test.
Thank you for that. Newton Wasike is asking, how does an ectopic pregnancy occur?
Ectopic pregnancy occurs when the implantation does not take place in the uterus. In an ideal pregnancy, the implantation needs to take place in the uterus, but in an ectopic pregnancy, the implantation takes place at a place that is not the uterus, and commonly in the fallopian tubes. Remember, it's just a tube and it is very, very tiny, so the fetus cannot be able to grow.
Thank you so much. I hope, Newton, you answered. Teresia Getich is asking, I got a friend who cannot conceive. She has tried several times, but nothing. What could she do? Really need a baby when is a first-timer mother with negative rhesus factor receive the anti-D?
Sorry, you're not clear.
Teresia is asking, she has a friend who cannot conceive and she has tried several times, but nothing. What could she do? She really need a baby when she is a first-timer mother with negative rhesus factor. It's like her friend has rhesus negative factor there, and that's make her not conceive.
I really don't think having a rhesus negative factor is a cause for fertility unless there was a miscarriage or she had a pregnancy and then there's what we call anti-D, an antigen that is given to all rhesus negative women so that their bodies do not fight the baby. So in the case that she had an earlier pregnancy and anti-D was not given, so this means that her body is fighting the fetus. Now, but if she has never conceived at all, then she needs to see maybe a fertility therapist, maybe check her hormones and maybe have a few tests done to be sure of what the major problem is. I really don't think having a rhesus negative is a cause of infertility. Donald.
Hi, hello. I want to put an input from what Teresia has asked. I think the question she was asking was the friend is trying to get pregnant, but she has not been able to get a baby. And then the question on anti-D was the second question. So she's asking what can she do? This is what will be my opinion. Usually there is what is called a preconception care. That friend should consider signing up for a preconception care. During this care, both the lady and the husband will be screened for any problems on fertility. Remember, there can be many causes of infertility. So in case we get any findings through screening, then they'll be advised accordingly so that they're able to conceive. If at all the problem that they have cannot be solved, that is when they'll be advised for intravitreal fertilization. So the most important thing that she should do is sign up for preconception care or visit a fertility center. The second question that she asked was, when we have a first-time mother, when should she get an anti-D? Well, for mothers with rhesus negative, the first dose is given at 28 weeks and the second dose is given at 34 weeks. Then after birth, another dose is given within 72 hours of giving birth. It is the same thing with abortion or miscarriage of in a rhesus negative mother. She should be given an anti-D injection within 72 hours of the miscarriage. However, if the miscarriage occurred before 12 weeks of pregnancy, the anti-D is not recommended, it's not needed. Thank you, that was my input.
Thank you so much.
Take it back.
Thank you so much, Donald and Linda. The next question is from Lydia Wanjiru. What if the fertilized egg fails to attach itself on the uterus wall? Do we still call the shape of that uterine wall menstruation or miscarriage?
That now is termed to as a miscarriage because fertilization already took place. Menstruation only occurs if there was no fertilization.
Thank you. I hope, Lydia, you are answered. We have a question from Ruth Ogola. How does one get twins, triplets, or quadrats?
Okay, the physiology behind twins, it could be there were two ovaries that were released by the woman. And so this means that ovulation either took place from both the right and the left ovum, and both were fertilized. That is one way. And that will now result to what do we call them? The twins who are not identical, the fraternal twins. Now, then we have this other occurrence whereby there is one ovum that now divides itself on fertilization and brings about more than one fetus. That now gives us the identical twins. Is that okay?
Yeah, that's okay. Thank you. I hope, Ruth, you answered. So the next question from Ruth, she's asking, is it okay for a pregnant mother to take hypertensive drugs?
Yes, there are hypertensive drugs that are recommended for pregnancy and not the regular hypertensive drugs. Please note, it's not the regular hypertensive drugs. So if you are hypertensive before pregnancy, you need to see your doctor for them to change your hypertensive drugs. There is an echo, sorry. It's unclear. Your provider needs to change the hypertensive drugs to what is safe for pregnancy, and the hypertensive drug that is commonly used by pregnant women is what is known as methyl dopa.
Thank you. I hope, Ruth, you answered. So we go to the next question from Ruth. What causes fetal death in the womb?
There can be many causes. One, maybe the fetus had problems on its own, maybe malformations, and the body just had to do away with the fetus. It can also be as a result of what we call as intrauterine fetal growth restriction. The fetus is not able to grow well in the uterus, and that might lead to its death. And also some other causes that we are not always able to explain, but those are just among the major causes of fetal death. And then maybe when there is a leakage of the amniotic fluid, and we have an infection that is occurring to the fetus.
Thank you. I've seen another question on twins. So Wendy is asking, can you have twins if you want to? I mean, is there a specific medical procedure for conceiving twins?
Yeah, that's interesting. There's a drug that can be prescribed for you to increase your ovulation, so that you're able to produce more than one ovum for you to have twins. It is possible.
Thank you. I didn't know that. That's interesting. So we have another question from Ruth. What happens where there is a fetal movement reduction?
It simply means that the fetus is kind of endangered. It's not as active as it was before. So we listed it as one of the danger signs, and so we need to know, why is the fetus not moving, or why has the movement reduced? Is it that the fetus has a problem, or we have a problem with the maternal pelvis that the fetus is not able to move around properly?
Thank you. Wangari Matupi is asking, when pregnant, when should one stop having sex with their partner?
You can have sex with your partner as long as you are comfortable. We have women who have sex to their last day of pregnancy, and it goes well with them, just comfort. If you're comfortable, there's no harm.
Thank you. We have a question from Lydia Wanjiru. Does induction fail? I was induced at 42 weeks. I couldn't dilate my baby. It was in distress, and I had to go for emergency. Does it mean that my cervix is the rigid? I don't know. That's the second pregnancy. I don't know. I must book for elective CS.
No, induction might not always succeed, because we have factors that lead to successful vaginal birth. It can be an issue with the pelvis. If the pelvis is small, not to allow the baby out, even if you're induced, the outlet is too small for the baby. So even if induction has been done, and the baby cannot fit outside the pelvis region and move out, then the induction will definitely fail. And so, and probably maybe she had a big baby. It can also be a factor that led to a failed induction, because now if the baby is big and cannot fit out through the pelvic opening, then there's no way she can have a normal birth. But if now the big baby was the problem at that point, and in the second pregnancy, there's what we call trial of SCAR. We have some facilities that allow a woman to try vaginal delivery after a first CS, and it can be tried depending on the cause of the failed induction. Yeah, I can see Lydia saying the baby was 3.1 kgs and she couldn't dilate even an inch. Maybe now an issue with the cervix or her pelvis now, having a pelvis that cannot allow out the baby.
Thank you. I hope, Lydia, you answered. So we'll go to our next question from Banuna. Can miscarriage happen without the lady knowing?
Without?
The lady knowing.
Yes. Now, very early in pregnancy, some people have pregnancies and they miscarry without having them knowing they were pregnant, because maybe it will just go out as a period if they hadn't anticipated a pregnancy. Sometimes a woman will just wake up to blood clots and they have had a miscarriage. And then we have those cases where maybe she will experience abdominal pains and all those symptoms of a miscarriage. But it is possible for a miscarriage to happen without her knowing.
Thank you. I hope, Banuna, you answered. So we have a question from Josephine Magecho. What causes backaches? I think during pregnancy. I don't know.
We discussed and said we have the hormone progesterone that is responsible for relaxing the body muscles. And now during pregnancy, we have the pelvic bones that also need to be relaxed for them to like give way for the baby to go out. So during that relaxation of the muscles, and now we also have the relaxation, the pelvic bone is connected to the spine. And so as those muscles are relaxing, then there will definitely be a bit of back pain. And to add on to that, we also have the change of posture in pregnancy. We have the fetus applying so much pressure towards the back of the woman, and that will also lead to backache.
Thank you, Linda. I hope Winnie, your answer. I hope Justin, you answered. So we have a question from Irene. Is bleeding a show of miscarriage?
Yes, it is one of the signs of a miscarriage, but not certainly a complete miscarriage. Okay, in the hospitals, you will hear terms like incomplete abortion, threatened abortion, and all that. So any bleeding, you need to be checked. You can have a miscarriage that was threatened, so it didn't successfully occur, but the baby is still at risk. And so measures need to be put in place to stop the miscarriage from getting completed.
Thank you. We have another question. Someone is asking, why do pregnant mother eat stones that are?
Yeah, I mentioned pica, and I said it is not healthy at all. It simply shows that they have probably some minerals lacking in their bodies, and that is now where they need to get some supplementation from IFAS, and now they need to get tests to get to know what exactly are they lacking so that it is supplemented. Most of these stones that they eat may contain harmful substances to the baby and to the mother as well.
Thank you for that. Yopatula, you answered. Lydia Wanjiri is asking, is there a special regime of ARVs given to pregnant women?
No, it's the same regime. And now there's an addition. Now, when we have a pregnant woman who is HIV positive, they are also given medicine for the baby early in pregnancy. They do not wait for the baby to be born. So that's the only addition they will have to them. And now this is prophylaxis for the baby. Otherwise, it's the same ARV drugs.
Thank you. I hope, Lydia, you are answered. So the next question we have from Marcio Biero. I think you answered that. From Sola Juma, can vaginal infection cause miscarriage?
Yes, it can. Women really need to be careful with infections. That is why I was talking about the vaginal discharge. Any abnormal discharge needs to be treated. These infections may cause an infection to the fetus. It may lead to their death, and that will definitely lead to a miscarriage. These infections can also lead to untimely opening of the cervix, and this will eventually lead to a miscarriage. So all infections need to be treated.
Thank you. You have another question from Jacqueline Auma. What causes stomach pains during pregnancy? It's on and off. I think you answered. Stomach pains during pregnancy.
Yeah, one of the main, causes of stomach pains during pregnancy, and that is lower abdominal pain, is infections. Pregnant women are very prone to UTIs, and so they need to get checked frequently. And with a UTI with lower abdominal pain, maybe you need a urinalysis done on you to confirm whether you have an UTI or not. And if it's not an UTI, then probably an ultrasound to make sure that the baby is okay. And then if that is all okay, then could be just hormonal issues, and that can be managed. Any other question?
Yes, we have from Beryl. Why must a pregnant woman lay on the left when sleeping?
We have what we call the inferior vena cava. I didn't want to go into much anatomy, but when a woman is lying down and the fetus now lies on that major blood vessel that takes blood back to the heart, it might lead to the blood remaining on the lower side of the body, and that might lead to edema. And then there will also be insufficient blood going back to the heart.
Thank you. I'll tackle all questions, so I'm not skipping any question.
Sorry. I just realized the question was, she asked why she should not sleep on the left side.
Oh.
He should sleep on the left side. That's the best position. The right side is when now they are going to lie. The fetus is going to fall back on the blood vessel. So the right position is the left side position.
Thank you for that correction. We have a question from Kelvin Musioka. Can one-day pregnancy be tested?
When?
One-day pregnancy. Can you test one-day pregnancy?
No, you can't. Yeah, you give yourself up to about 6 days for HCG to be produced.
Thank you. We have a question from Lydia. Are there known causes of brightened ovum?
I've not seen any known causes, honestly, but we can try and find out if there are any.
Okay. From Judy, what's the color of amniotic fluid? If it breaks, does it vary how would know the baby has popped?
Has stopped?
Popped.
Oh, pooped.
Yeah, pooped, yeah.
All right, yeah. Normally, amniotic fluid is straw colored, a bit off-white. Not now, how do I illustrate that color? It's just a bit white. I don't know if you've seen the straw from either rice or grass, but it's a little bit white colored. But now when we have fetal distress, that is when now the baby has pooped in the uterus, it turns green. And now this is what will be used to identify the level of distress the fetus is in.
Thank you. I hope, Judy, you answered. We have a question from Jacqueline. Then, what if a woman does not take IFAS? What's the effect on the mom and the unborn baby?
No, we said IFAS is very, very key in the formation of in the development of the fetal body parts. We have conditions such as, I don't know if you have seen images of babies who have dimples in their spinal cord, or the spinal cord is not continuous, or they have organs that are missing. You've heard of babies born either without lungs or something. And this iron is very key in the formation of those organs. That is why we insist on iron supplementation starting very early in pregnancy. And if possible, even before pregnancy, preconception, start taking your IFAS so that your body has enough iron to facilitate the development of the fetal body parts. Now, if it's iron is low for the woman, she might end up bleeding so bad. We have what we call postpartum hemorrhage, and we have women who bleed to death. So that is why they really need this iron supplementation. Remember, the blood level for the mother needs to go high because she's also supplying the fetus. So they both need to have adequate iron levels.
Thank you. I'm actually learning a lot from the questions. Our next question is from Monica. What can one do if medicate septrin during month 3 of pregnancy?
What would they do if they took septrin?
Yeah, self-medication of septrin.
Kindly, let's not self-medicate in pregnancy at all. Do not. Even if it's that minor sore throat, you don't need to go get septrin for yourself. Get to your health facility and get medication that are allowed in pregnancy. We are not going to give excuses for that one.
Thank you. I think everyone has had that. So our next question is from Leonida, saying, I have a friend of mine who was diagnosed with fibroids 5 years ago. She was told by the gynecologist that she can conceive, but she has tried several times to conceive, but unfortunately she haven't. What might be the reason behind all this, or can the lady be helped?
We need to get to know the size of the fibroids. I have seen women conceive with very small fibroids that can allow for the fetus to grow. You see, fibroids grow in the uterus. And so if they are very big, there is no space left for the fetus to grow. And that will, of course, mean the woman cannot conceive. So if they are small, some women conceive, and then during delivery, if it's through a CS, the fibroids are removed as well. But in the case of very big fibroids that the fetus cannot have space to grow, the fibroids need to be removed before conception. So I think she can have them checked again and maybe get a second opinion. And I guess in those 5 years, they could have grown a bit more than they were initially.
Yeah, true. So thank you for that. I hope, Leonida, you answered. Lydia is asking, what else can be taken to replace IFAS? IFAS comes with high level of nausea.
Yeah, I know IFAS is, some women also complain of some bitterness with IFAS, but IFAS is just iron and folic acid supplementation. So we have different brands. I mentioned this particular one because it's the one that is available in all health centers and it is free. It is given free to all pregnant women. But if you're able to buy more expensive supplements, you can. We have other brands. We have, I think there's one I've seen known as Pregnacare. Basic, just get IFAS supplementation. It doesn't matter the brand, get what you can manage and what does not give you all those side effects. And if you cannot manage to buy other brands of IFAS, you can always take this IFAS with meals. Okay, that is for those who are not able to buy maybe a brand they can tolerate.
Thank you. I hope, Lydia, you've had and the rest of us. A question from Wendy. You answered that question. From me, Gachao, from what I have just learned about fertilization, conception in the fallopian tube, which forms a zygote, then implantation takes place at the wall of the uterus, which becomes an embryo. It leaves me wondering about the use of copper T or coil method of family planning, because I understand it can allow conception but interfere with implantation. If this is so, can it be assumed that the coil terminates pregnancy?
No. The cases of one of the side effects of copper T is the ectopic pregnancy. Copper T, I listened into the session on FP and it was well explained. Copper T prevents implantation. You see, copper T is in the uterus, okay? So it gives the body like a false feeling that there's something in the uterus, and so nothing else can implant in the uterus. So if fertilization takes place on a person with copper T in most cases, and that is what they call a side effect of copper T, it might occur as an ectopic pregnancy. And in some weird cases, yes, but it's a very small percentage of women who have implantation taking place in the uterus with copper T. However, it is a very small, like 1%. Yeah.
Thank you. We have another question from Lydia. What is the correlation between high pressure and fetus death? In case the fetus starts peeling off its skin when it's dead in the uterus, what harm does it pose to the mother?
Now, high blood pressure in pregnancy, of course, will resort to a lot of pressure for the fetus. And this might most probably kill the fetus as well. Now, if we have an intrauterine death, of course, when something dies, it starts decaying. So you can imagine a tissue decaying in your body. It will, of course, lead to infections. And it might lead to an infection to the blood of the mother, what we call septicemia. And now this will cause a lot of problems for the mother when you have an infection. It can also cause an infection to the reproductive organs, because the infection will, of course, start with the nearest organs, from the uterus, affecting the fallopian tubes all the way. Though I think you should be able to notice a fetus that has, when you have an intrauterine fetal death, as long as the fetus had already started maybe kicking, and if you're attending your clinics, it's very easy for it to be realized early. She mentioned the peeling of the skin, and that is because of the decay that takes place normally for any tissue that is dead.
And yeah, thank you for that. We have a question from Josh. What can lead a woman to have a child with disability, mostly mentally and CP? How can one prevent?
Mental retardations could either be genetic. It could also be due to the way the cells from the woman and the mother were binding and dividing. Maybe there was a mishap somewhere and something went wrong. And now that is how we have most of the malformations, either genetic or now due to the substances that the woman took when they were pregnant in the first trimester that affected the baby, like drugs, that would lead to malformations as well. Now, cerebral palsy occurs during the process of birth. I wish I had time to explain all the factors that come into play during the birth process. And so we have maybe a delayed birth, and this is not to blame anybody for it, because it can be a delay due to the mother's body. The woman is not able to, maybe she's not sufficient enough to pass out the baby, or maybe the fetus is big. We have various factors that play around for us to have a successful labor. And so when we have one of these factors not coming in as they should, then we have delayed labor. And during delayed labor, the baby is not, now you remember maybe the placenta supply was cut off during the labor. As the baby is being squeezed out, the placenta is not able to supply the baby with enough oxygen. And so there's no oxygen going to the brain. And that is what will lead to dying, the death of a portion of the brain or the whole brain, and that is now what causes cerebral palsy. Are we okay? There's someone asking, can you tell someone is developing cervical cancer during delivery by checking the cervix appearance? During delivery, it's very tricky to visualize the cervix. This because there is a lot of fluid coming out, and during delivery, you're focused on delivering the baby. So you might not be able to visualize the cervix. But concerning cervical cancer, there are screening services available. Even if you go to your nearest health facility and request for cervical cancer screening, it will be done on you. So you can make it a routine to just get yourself checked. You need to do cervical cancer screening once every year, as long as you are sexually active. You are a sexually active woman. And now if you have a daughter, in Kenya, they are being vaccinated at the age of 10 years. So you can consider having your daughters vaccinated against HPV. HPV is the virus that causes cervical cancer. And the vaccine is also available in all health facilities here in Kenya. Our moderator, are you still with us?
Sorry, I was muted.
Sorry.
Someone is asking what causes, I was muted, I didn't know. What causes one to bleed throughout a pregnancy? Because it happened to me, but I was never told the cause.
Mostly it's caused by where the placenta is implanted. I don't know if this makes sense, but normally I hope you have seen how the uterus looks like. And so the placenta is also implanted at the top part of the uterus, okay? But in the case the placenta is implanted lower, the low implantation of the placenta, that might cause intermittent bleeding in pregnancy. The pregnancy can go to term depending on the level at which the placenta was implanted. It becomes of much alarm if the placenta is implanted near the opening of the cervix. I hope that makes sense.
Yeah, it does make sense. We have another question from Immaculate. A friend took H. pylori kit during her first trimester. She was not aware of the pregnancy. Can it have some effects to the baby?
We can't really tell, but we hope not. So she can just continue with her checkups, hoping she's not having much effects. The drugs in the H. pylori kit may not have that severe effect, if any at all. So she shouldn't be worried.
Thank you. So we have a question from Virginia. Is it possible to have a normal delivery if one has a scar, maybe of a cyst?
Yeah, it is possible. I said there are some facilities that do what we call the trial of scar. Excuse me. And that is for if you have had one CS scar, you might be given an opportunity to try delivering vaginal delivery, but it is also dependent on the reason why the CS was done.
Thank you. So we have a question from Josh. So So we have a question from Wendy. Is it true that during childbirth, when the baby accidentally inhales or swallows the amniotic fluid, would eventually lead to an inactive baby, characterized by drooling of saliva, slow learning, etc.? In summation, what are the factual consequences of the baby inhaling or swallowing the amniotic fluid during birth?
When a baby inhales or takes in the amniotic fluid during birth, might lead to what is known as birth asphyxia. Okay, so birth asphyxia is when that fluid has been inhaled and goes into the lungs of this baby, and now the baby is not able to have enough oxygen supply for their body. All right, now if this asphyxia is prolonged, it means now the brain of this baby is not having enough oxygen. Just as it's the same process as in cerebral palsy, because now the baby is outside the uterus, so it was being supplied by the placenta, and now the lungs have been engorged with this fluid that the baby has aspirated, and they are not able to supply oxygen. So that is now what will lead to those effects, like maybe being brain retardation, and eventually maybe cerebral palsy, and those other effects that he has mentioned.
Thank you. I hope, Wendy, you answered. We have a question from Judy. How can one know she has a prolonged labor and should go for a CS, yet we have women who labor for a week and deliver normal?
Labor is very individualized. And now that I said, I wish we had time to talk about the process of labor. But during labor, we have all those factors that come in. Every woman maybe has their rate of the cervix opening. A woman maybe might be having their cervix opening very slowly. There's another one, there are women who labor for very few hours. So it depends with the woman's body, okay? But now it becomes alarming if now, for example, we had the fluid may be drained out, meaning at this point the baby is dry, the baby might have an infection. We have the fetal heart being monitored, and maybe your caretaker might realize that we are having the fetal heart depreciating. That means now this labor is being prolonged and it's having effects to the baby. The baby movements might as well be noticed to have reduced. Now that is when now we say that this prolonged labor is becoming of danger. But now if it's just the pain that comes and goes, this woman that you say is having labor for a whole week could be forced labor that has not become active labor yet. So you need to be able to define whether it is false or true labor. If there are signs of true labor, then we need to identify if it is becoming prolonged labor in real, either because maybe there's a blockage, I mean, there's the pelvis is not adequate, or maybe the baby is big, or there's another issue. Just differentiate between true and false labor.
Thank you. We have a question from those who are following us in Facebook. Mildred Lovely is asking, for how long does ectopic pregnancy survive in a body? Can someone get pregnant while on a? I think there are two questions.
The first one, an ectopic pregnancy cannot survive for long, for just 2 weeks, because immediately the cells start dividing, and then there's formation of the embryo. As it starts enlarging, definitely if it's not identified early, it will of course cause the fallopian tube to burst. What's the second question?
Can someone get pregnant while on her periods?
On her periods?
Yeah.
I have not heard of that, unless they had another the other ovary ovulating, but it's kind of not possible because we already have the menstruation cycle that is being controlled by the hormones, and it's being controlled by the brain. So there is no way that center of the brain is asking the body to release hormones to enable menstruation, and at the same time asking the body to release, to give hormones to allow ovulation.
Thank you. I hope Mildred, you have heard that. Mildred, there's a lose or loss of airline after miscarriage. What can someone do about it?
Hormonal issues. I think we've also seen breastfeeding mothers lose their hairline. I would say they just give themselves time for their body, for the hormones to balance back.
Thank you. We have another question from Jackie Kirobe. After how many months after miscarriage is a woman supposed to conceive again?
Okay. In my opinion, this is my opinion, they should give themselves at least 3 months or so for the hormones to be in balance. You remember, after fertilization has taken place, now we have the progesterone that is going up, and for them to be able to conceive again, they need to have their hormones in balance again. So they also need to give the body and the uterus time to heal so that it's able to hold in that next pregnancy. So I suggest they shouldn't be in a hurry to try and conceive again. I know the torture with a miscarriage, it's not easy, but they need to be able to give their body and also their mind time to settle down.
Thank you. We have the last question from Facebook. Scania Maria is asking, can you tell that someone is developing cervical during delivery by checking the cervix appearance?
Cervical, sorry?
Cervical appearance, the cervix, how it appears.
If we can check if there is cervical what?
Cancer.
Oh, cervical cancer. I answered that question again, and I say during delivery, it's quite hard because we have a lot of fluids and a lot of blood happening during delivery. So we may not be able to visualize the cervix and do the test that is known as viability. But you need to have your cervix always screened once every year. Have viability done, or if you're able to do a pap smear, you can go and have it done.
Thank you. We have a question from Josh. When a woman is pregnant and she is vomiting, how can you prevent the vomit?
Now, sometimes it's as well due to the hormones of pregnancy, and we have ways that can help her minimize the vomiting. In the first place, is there anything that is causing her to vomit more? Maybe there's a certain type of food that she's eating and is causing her to vomit. Maybe there's a smell that is causing nausea and vomiting. Now, when she has gotten to know the factors that are leading to her vomiting, she can be able to cut them out. Now, the other vomiting that is due to hormonal imbalance, then most of these times she needs to check into a hospital and probably get taken care of. With vomiting, there's a lot of water loss, there's a lot of electrolyte imbalance, so she needs to check in and get them checked and balanced as they should.
Thank you. We have another question from Mary Akoy George in Facebook. Why does pregnant take more period to birth? It's funny.
Why does?
Why does it take long from the period of pregnancy to birth?
I mean, we were created that way. We have to be pregnant for 9 months.
I hope, Mary, you answered. We have a question from Lydia. What's the remedy for keloids after years? Is there a way I can avoid them on the subsequent years?
You said keloids?
Yeah.
I think that there's a medication that is given for keloids and sometimes surgery. So it depends with the way your keloids are forming. And so you can consult your doctor and get to know the best thing that can be done concerning your keloids. Some people have an issue whereby anytime they have a cut somewhere, they develop a keloid. So I think it's more of a person's body makeup.
Mhm. I'm trying to check if there's another question.
Okay.
Mohammed Ali is asking, what causes fistula among pregnancy women?
Fistulas are caused by difficult labor. Difficult, I mean, a labor that was probably very prolonged, and there was a lot of, I'm trying to get terms that you guys can understand. Probably, for example, if we had a big baby and they were trying to force their way out of the lady's system, and then now we have pressure being applied on the walls or along the passage, that might lead to tear, and then there will be connection between the urinary system and the digestive system, where we have the anus, and when they get connected, due to that tear that happened during that difficult labor, is when we will have the fistula happening.
Thank you. I hope Mohammed Ali you answered. We have a question from Lydia Wanjiru. What are the causes of spina bifida, SP on newborns?
Mainly it's caused by insufficiency of IFAS, that is iron and the folic acid. We said iron and folic acid is very crucial for the development of the fetus. That's the major cause. We may have other causes.
Thank you. We have I think the last question from Wendy Ochieng. What are the differences between vaginal discharge of ovulation and early pregnancy, and also the breast tenderness? How can you note the difference?
I think there's a very thin line between that, because they will mostly look alike. During ovulation, we also have peak discharge, as well as in pregnancy. Breast tenderness, I think, is just about the same feeling. The only difference is in ovulation is happening in a duration of, say, 2 to 3 days. So if it's not a pregnancy, this will occur and then the symptoms will just disappear. After the ovulation period, we now move to a different stage of the menstruation cycle, and we have the breast tenderness clearing. We also have the discharge now becoming thinner as the cycle continues. But in pregnancy now, we have the continuing of these symptoms, because pregnancy is not going anywhere, it's there. So breast will continue being tender, the discharge will still continue being there.
Thank you. I think there's no other question. I really appreciate Linda for answering this question. On my side, I've learned a lot, and I didn't imagine like we'd love such a long session and such a wonderful presentation and well answered question. I can see in the chat box, Eziana Linda saying thanks for the session. Ivy saying that was an amazing session. Amina Wakishwa saying it was amazing, but someone is asking a question. Opiambo Gabriel, explain further on empty pregnancy and physiology about its disappearance.
It doesn't just disappear, it has to be removed. Fertilization took place. The only difference here is in a viable pregnancy, we have a live fetus, a fetus that can grow to a baby. But in an empty pregnancy, we have the sac, and inside it, we have the amniotic fluid but we do not have the fetus that would later develop to become a baby. So it has to be removed. So it just doesn't disappear.
Thank you for that. I hope Gabriel, you have got the answer. I can see in the chat box, Virginia saying I've learned a lot. Thank you. Thank you so much. I've learned a lot from Letitia. Donald is saying as leader, incredible. What a beautiful lesson. Learned a lot today. Banuna is saying thanks for the session. I understand some things I didn't during. Thank you so much. Maybe from the team, if you can't touch the notes, you can just use a thumbs up as a sign of appreciation to the speaker. Connie saying thanks a lot.
Can allow me. I would like to invite the team. I talked about the program that I have begun on education. There's a YouTube channel, a very young one. So there's already a video on cervical cancer. I have realized the question has come up. So you can check out the video and learn about cervical cancer. Oftenly, I upload content on just health education, and it's just in a language that you can understand. So you can engage in there, and also feel free to reach out to me. I am always available, and you can feel free to talk to me at any time. And I appreciate your being here. It has been an amazing, amazing session.
I'm so humbled, Naslinda, for that session, and I can see a lot appreciating the chat box. So thank you so much for that wonderful session. I can't say, I don't know how to put it, but thank you so much. I learned a lot, and I hope the members learned a lot. So I appreciate for that wonderful session. Maybe as you have heard, you can follow Naslinda, LinkedIn, Linda Kagendo. YouTube, you can follow me, Demystified, or you can use your email or reach out through a WhatsApp or call the number in the screen. So thank you so much, Naslinda. I think today we can, Josh is saying a great topic facilitated by a great human. That was so amazing. Thank you so much, Josh. I'm so amazed. We can have this session. I don't know if Nas Galula is in to have a parting shot for the session. Welcome.
Hi, how are you? Thank you so much, Katile.
Fine.
Thank you so much, Naslinda. That has been very exhaustive, and wow, what an impressive and a beautiful class. If I was to do my master's and you were my tutor, trust me, I wouldn't miss any class. Otherwise, thank you so much for all participants who were able to be there today up to this time. Mine is just to ask you that can you please follow up on what you've learned today? When you receive the presentations, go through them. In case of any questions, just like you've been asked, always reach out. Naslinda is there ready to help you. We are there ready to help you and to mentor and answer any concerns. In case there's anything private, because I've seen some questions were kind of private. People are referring to themselves, like I was like this during pregnancy, I was like this. In case there's anything that you probably feel is very private, you can always reach out and we discuss and help you out. Otherwise, it's a very beautiful program. I wish you well in your next classes and your next lessons. Keep it up and use the knowledge you've gained today to make change to the community that you serve, to the families that you are in, and to the people that you live with. Thank you so much, Katile. Back to you.
Thank you so much, Donald. I'm so impressed by that, and we can end the session at 9:03. And thank you so much, all participants. Wish you the best, and let's meet on the next session on Friday. Have a good evening, all.
Good evening.
Good evening. Good night, all.
Good evening. Good night, all.
Good night, all.
Good night, all.
Good night.